Specialists warn, if you're over 60 and you think taking omega-3 or just walking miles every day is enough to protect your balance and strength, I need you to stop there and listen. I'm a board-certified orthopedic surgeon, and along with a vetted group of 22 surgeons from several countries, we reviewed the evidence. The short version? Omega-3s help some processes. Walking helps your heart and endurance, but neither one by itself addresses the specific losses, proprioception, hip and ankle control, rapid force production, that actually lead to falls and loss of independence. If you want practical protection, you need specific, short drills that target the systems that fail with age. I'll show you 5 evidence-backed moves, how to do them, how often, and one sensible beverage strategy that complements the work in the clinic and in randomized trials. If you want more senior health, evidence-based routines like this, hit like and subscribe. We post practical guidance for people who want to keep living independently. Aging is not just losing strength. It's losing the timing, stiffness, and reflexes that let you react when your foot slips or a chair resists you. Studies out of the University of Pittsburgh and others show measurable declines in proprioception, the joint and limb awareness that tells your brain where your feet are, starting in the 60s and accelerating after that. The Journal of Gerontology and groups studying physical function have documented steady declines in muscle mass and strength, sarcopenia, that chip away at the ability to rise, step, and recover. And multiple analyses, including work published in the British Journal of Sports Medicine, tie simple tests like single leg stance times to future fall risk and reduced functional independence. In short, walk-in keeps your heart and lungs healthy, and omega-3s can help inflammation, but neither restores the systems that prevent falls. That's where specific exercises come in. Over the next several minutes, I'll take you through 5 practical moves, counting down from number 5 to number 1. For each one, I'll tell you why it matters, exactly how to do it, the dose, sets, reps, holds, frequency, what the research says in plain terms, and a safe regression and progression so anyone can start and then get stronger. These are low equipment, short, and built to fit into daily life, under 15 minutes total. Then we'll address the drink this line you saw in the title. I'll explain what kind of beverage has the best peer-reviewed support as a complement to these exercises, what the evidence actually says, and who should check with a doctor before trying it. Exercise number 5, heel-to-toe tandem walk. Why it matters? This is not just walking in a straight line. Heel-to-toe walking trains ankle stability, the small muscles that control your foot, and the dynamic balance you use every time you take a step.
In other words, it's targeting proprioception and the neuromuscular timing that stops a stumble from becoming a fall. How to do it? Stand near a wall or chair you can touch if needed. Take a normal step and then place the heel of your front foot directly against the toes of the back foot. Walk forward like that, placing each foot directly in front of the other, eyes open to start. Take 20 steps total, turn around carefully, and come back 20 steps the other way. Dose and schedule. Do this twice daily, ideally once in the morning as you move from bed to bathroom, and once in the afternoon or while waiting for something. 20 steps each way, twice per day. If you can do more, fine, but consistency matters more than volume. Research note. Balance programs that include tandem walking and similar proprioceptive drills are associated with meaningful improvements in balance scores in older adults. Trials referenced in Archives of Physical Medicine and Rehabilitation report substantial reductions in fall rates when such targeted practice is included. This move trains the nervous system to know where your feet are during single leg phases of gait. Regression and progression. If you're unsteady, regress by walking heel to toe beside a countertop or with one hand lightly on a chair. Shorten the stride so the feet are close but not fully overlapping. Progress by closing your eyes for 3 to 5 steps at a time, only if you feel safe and have a spotter or a secure surface to touch. Or do the walk on a soft surface such as a folded towel to make proprioception harder. Exercise number 4, chair squats. Why it matters. Getting up from a chair is one of the most functional tests of independence. Chair squats build the hip and thigh strength you need to rise safely, and they train rate of force development, the ability to generate power quickly when you have to stand up fast to catch yourself. How to do it. Start sitting in a sturdy chair with knees hip width and feet flat. Lean your chest slightly forward, push your hips back, and stand up by driving through your heels until you reach full standing. Slowly sit back down with control. Keep your weight centered and use your arms only if you truly need them. Dose and schedule.
2 to 3 sets of 8 to 12 reps daily. If you're aiming for speed training, add 1 set of 5 quick explosive stands once you're comfortable, focusing on rising quickly but safely. Research note: randomized trials and clinical studies in geriatric populations show that repeated sit-to-stand training improves lower body strength and functional performance, metrics associated with fewer nursing home admissions and better independence. The Journal of Gerontology has reported measurable gains in chair rise speed and strength with regular practice. Regression and progression. Regress by using a higher seat or allowing your hands to lightly push off your thighs.
Progress by lowering the seat height, holding a light weight at your chest, or adding a deliberate fast stand set once per session. Exercise 3. Standing hip circles. Control of the hip. Why it matters. Hip mobility and the ability to move your leg in a controlled arc protect you when you need to step around obstacles or recover your center of gravity. Hip stability also offloads the knee and ankle in compensatory movements. How to do it. Stand near a counter or chair for balance. Lift one knee slightly, to about hip height if you can, and make controlled small circles with the knee, first clockwise, then counterclockwise, 5 circles each way. Keep your torso upright and imagine tracing a smooth circle with your knee, no jerking. Dose and schedule. 3 sets per leg, 5 circles in each direction, once daily. You can do this while you wait for coffee to brew. Research note: targeted hip mobility and strengthening reduce compensatory patterns that increase fall risk. Clinical programs that include simple hip control drills improve gait stability and reduce the likelihood of trips turning into falls. Regression and progression. Regress by keeping the lift lower, only a few inches, or perform seated hip marches if standing is too difficult. Progress by increasing the circle size, doing the circles on a foam pad, or adding ankle weights when safe. Exercise 2. Isometric wall push, upper body for bracing. Why it matters. Many falls are arrested by grabbing or bracing with the arms. Isometric wall pushes build shoulder and upper body strength for effective bracing and improve the neural drive to the trunk, helpful in catching yourself when you stumble. How to do it. Stand facing a wall, palms flat at chest height. Press into the wall as if you were trying to move it. Squeeze hard and hold for 10 to 15 seconds, then relax. That's 1 rep. Dose and schedule. 3 to 5 repetitions per set, 1 to 2 sets daily. Hold each push for 10 to 15 seconds. If you have shoulder issues, reduce the height or force. Research note: isometric training is particularly useful for older adults because it builds strength without high joint loads. Small randomized trials and rehabilitation studies report improvements in functional reach and bracing effectiveness following regular isometric work in upper body and trunk. Regression and progression. Regress by pushing with a lighter force or using the corner of a table to reduce the resistance. Progress by standing further from the wall to increase range or perform partial push-ups from a countertop to add dynamic control. Exercise 1, the most important, single leg stance, why it matters. Walking is essentially a series of single leg stances. The ability to stand on one leg for adequate time predicts your balance, your reaction to perturbations, and yes, your independence. Short single leg times are associated with higher fall risk and worse functional outcomes in multiple cohort studies. How to do it. Stand next to a sturdy chair or countertop. Shift your weight to one foot and lift the other foot off the floor. Aim to hold the position, eyes open, for up to 30 seconds. Keep your hips level and arms relaxed or lightly on your hips. Switch legs. Dose and schedule. Start by aiming for 3 holds per side, 10 to 15 seconds each, twice a day. Work toward 30 seconds per leg 3 times daily if possible. Integrate it into daily habits. Stand on one leg while brushing your teeth or while waiting for the kettle to boil. Research note: studies in the British Journal of Sports Medicine and Journal of Gerontology link single-leg stance ability with fall risk and later health outcomes. Interventions that improved single-leg time corresponded with better balance scores and fewer injurious falls in at-risk groups. In some clinical trials, combining balance work with strength training, fall rates fell markedly. Examples reviewed in Archives of Physical Medicine and Rehabilitation report reductions in the range of about 30 to 40% when targeted training was implemented for high-risk seniors. Regression and progression. Regress by holding onto a chair with one hand and lifting the foot only a few inches. Progress by removing hand support, closing your eyes for brief intervals, or performing single-leg taps, lightly touching the toes of the raised foot to a target in front, back, side, and returning to balance. Safety for every exercise. Start next to a wall or chair.
If you feel sharp joint pain, dizziness, chest pain, or sudden shortness of breath, stop and seek medical advice. If you have unstable heart disease, recent surgery, severe vertigo, or are on blood-thinning medication with frequent bruising, check with your healthcare provider before starting new exercises. For people with severe mobility limitations, do seated versions first and work with a physical therapist when possible. A practical short routine you can do in 10 to 15 minutes. Do one round of each exercise and repeat the single leg stance and chair squats to make up the time. Example, tandem walk 20 steps times 2, chair squats 2 sets of 10, hip circles 3 sets per leg, wall pushes 3 times 12 to 15 seconds, single leg stance 3 times 20 seconds per leg. Do this routine once daily or split it into 2 shorter sessions. The key is consistency. Just a few minutes every day is better than an hour once a week. Now, the drink. The title promised, "Drink this." The transcript we reviewed didn't include nutrition data, so I went to the evidence. Here's a careful, clinically grounded recommendation. If you want a beverage that meaningfully complements these exercises for preserving or rebuilding muscle and function after 60, the strongest peer-reviewed evidence supports a protein-rich, leucine-enriched oral supplement or shake taken around the time of your exercise or daily routine. I'm not saying this drink replaces omega-3s or the exercises. Think of it as supportive fuel for muscle repair and growth.
What the research actually shows, a meta-analysis published in the American Journal of Clinical Nutrition by Cermak and colleagues found that protein supplementation augments gains in muscle mass and strength when combined with resistance exercise. Randomized controlled trials in older adults, such as those summarized by Thieland and colleagues, demonstrate that supplemental protein increases lean mass and improves physical performance in frail elderly participants when given alongside training. Other studies, including work on the essential amino acid leucine, show that leucine-rich formulas stimulate muscle protein synthesis more effectively in older adults than protein alone. These are peer-reviewed, randomized, or meta-analytic findings in reputable journals, and together form a consistent message. Protein plus exercise works better than exercise alone for rebuilding muscle. What that looks like in practice. A practical beverage choice is a 200-300 milliliter protein shake containing roughly 20 to 30 grams of high-quality protein, whey, or a complete plant blend, ideally with about 2.5 grams of leucine or an overall amino acid profile that provides that leucine dose. Take it after your exercise session or within an hour of your routine. If you can't tolerate dairy, there are leucine-fortified plant options. If you're already consuming adequate protein throughout the day, a full shake may not be necessary. A smaller 10 to 15 gram protein snack may be sufficient, but trials showing the largest gains used higher amounts around exercise. Important caveats and safety. This beverage is an adjunct, not a fix. If you have advanced kidney disease or are on dialysis, high-protein supplements can be risky. Discuss with your nephrologist. People with diabetes should monitor carbohydrate content and blood sugar. If you take medications that interact with amino acid supplements, check with your prescriber. Pregnant people, those with active cancer under treatment, or anyone with complex medical issues should consult their physician before starting a concentrated supplement. Finally, avoid marketing hype. No shake will replace the neural adaptations and balance training you get from targeted exercises. How this beverage compares with omega-3. Omega-3 fatty acids have benefits, anti-inflammatory effects, and some data suggesting modest support for muscle metabolism in certain trials. For example, some controlled studies indicate omega-3s can enhance muscle protein synthesis under specific conditions. But when it comes to rebuilding muscle mass and improving functional performance in older adults, the consistent randomized and meta-analytic evidence favors protein, especially with leucine, combined with exercise. So don't dump your fish oil if it helps your heart or inflammation. Add a protein strategy to address the muscle synthesis side of the equation.
Putting it together, a 10 to 15-minute daily plan. Morning, after getting up, do your tandem heel-to-toe walk and single leg stance while you brush your teeth. Midday, do chair squats and hip circles while waiting for lunch or standing in the kitchen. Evening, wall pushes and a second single leg session. If you train with a protein shake, have a 20 to 30 gram leucine-enriched protein drink within an hour of your main session. The whole set can be done in a short block or split into micro sessions throughout the day. Consistency wins. Aim for daily practice. Realistic outcomes and what the evidence supports. When older adults add specific balance and strength drills to their routine, clinical trials show measurable improvements in balance scores, chair rise speed, and single leg stance times. Programs with these ingredients are associated with fewer falls in at-risk groups. When protein supplementation is combined with resistance training, randomized trials and meta-analyses show greater lean mass and strength gains than training alone. Put another way,
Targeted practice changes your nervous system and muscle function. The right nutrition provides the building blocks for adaptation. Both are required to shift your risk trajectory. Final practical notes before we close. Start small. If you can only do one thing today, do 3 single leg holds per side while you wait for your coffee. If you can do 2 things, add chair squats. Build up to the full 5 moves over 2 to 4 weeks. Track progress by noting whether you can hold single leg stances longer, stand from a chair more quickly, or walk heel to toe without wobbling. If any exercise causes sharp pain, stop and check with a clinician or physical therapist. If you're interested in a specific protein formula, ask your doctor about recommended products, and if you have kidney problems or other chronic disease, get medical clearance. Which one will you start today? Tell me in the comments, are you trying the single leg stance, the chair squat, or the tandem walk first? I read what you write and I reply. If this video helped you, share it with a friend or caregiver who needs a short, practical plan to preserve independence. Walk less like you're logging steps and more like you're training the tiny moments that keep you upright. Omega-3s and walking are useful parts of a healthy life, but after 60, the difference between falling and staying steady is often a single targeted exercise, done consistently and fueled by adequate protein. Try one move today. Try the routine for a week. Come back and tell me what changed. Thanks for watching. Stay practical, stay consistent, and take care of your balance. If you want more evidence-based senior health tips, subscribe and we'll bring more routines you can actually do at home.